dog.
Morning, Simba. How are you? Noxy, how are you?
Right. Can we talk sinuses, Doc?
Sinuses.
I think it's important for us to get this conversation underway. We are in that season now where either sinuses are going to stress you out, you're going to catch a cold, or something's going to happen. My first question for you, because I suffer from hay fever.
Okay.
Sinuses, hay fever. Shall I find a name?
Not from the Nasim.
Ajina.
Yes.
Do tell us the difference.
You know, whenever someone sneezes, they say, "Dog, I'm suffering from my
sinuses." Yeah.
So maybe this is the perfect time to correct everyone, including the two of you.
Let's go.
So hay fever, when you're sneezing, it doesn't mean that you have sinuses. The medical term for sinuses is sinusitis.
Mm-hmm.
So there is what we call sinuses that are around your nasal passages. So these are air cavities within the bones of the face. So you have 4 sinuses, 2 that are above a pair that is above the eyes, another that is called the frontal sinuses, and then you've got the maxillary sinuses that are below the eyes, and then you have 2 other pairs, the ethmoidal sinus and the sphenoidal sinus. These are smaller. So when you're having sinusitis, we are saying there is now inflammation within these sinuses, because these sinuses they communicate with the nasal passage.
Okay.
Yes. So the mucosal layer of the nasal passage is continuous with the mucosal layer of these sinuses. So whenever you have a flu, or when you have a hay fever, when you're sneezing, when you have an infection in the nasal passage, these sinuses can also get inflamed, or they can also get infected. Then you get what we call sinusitis.
So I do blocked nose here.
Yeah, blocked nose is one of the symptoms of sinusitis.
Okay.
So you can have blocked nose, you can have a dull pain in the center of your face, around the nose. It's dull, heaviness. Some people can describe this as heaviness in your face. You can also have a headache, you can also have fever. So when you have those symptoms, we can diagnose you with sinusitis.
Okay, so not just because you've got a big nose, it could be the sinus is causing you stress. Jeans very nose.
Because I've said okay, Noxy, everyone has got sinuses. Remember, I said we all have these sinuses. So so when you get sinusitis, it comes. Thank you very much. You're learning. So usually it comes after you have a flu, or if you sneeze a lot, if you have hay fever, you can also get sinusitis. Because if you get inflammation within the nasal passages, because I said the sinuses are continuous, the layers are continuous within the nasal passages. Yes. So if you have an infection in the nasal region, the sinuses can also get infected or inflamed. Then you get sinusitis. So people that have hay fever, people that have if you get a flu, if you're sneezing a lot, you can also get hay fever if the connection is blocked. So if there's blockage of the connection between the sinuses and the nasal passages, there will be accumulation of fluid and phlegm and mucus within these sinuses, and it creates a good culture for infections, and then you can get infection within these sinuses.
Now, we hear a lot about chronic situations. Do we have any chronic sinusitis issues that are available, that are out there?
We can classify sinusitis as acute,
okay,
or chronic. Most people present with acute sinusitis, which can resolve by itself, or it can resolve by supportive management, taking a painkiller, drinking a lot of water, using nasal decongestants, such as the steroid nasal sprays. You can also use a saline nasal irrigation. Saline is just salt water. Yes. So when you irrigate, you can treat acute sinusitis. But if these symptoms continue for up to eight weeks, then we call it chronic sinusitis. So people can have chronic sinusitis. These are people that are immunosuppressed, HIV positive people, diabetic people, the elderly, or the very young people. They can get chronic sinusitis.
All right, before we carry on, I've got a message that came in on our WhatsApp hotline. Before we read that one, though, don't forget this is brought to you by Cold Seal Lozenges. Now, I have a message that's coming. Doc, every time I try to blow my nose, my headache aches too bad. What causes that? It's actually the headache that's aching. So that's a terrible headache. What causes it? That's from my catch.
That's an unfortunate experience on the part of the listener. It can happen just from a normal flu or just from hay fever, but they also need to get checked for a possibility of sinusitis, because when you have sinusitis, you can have this sneezing, the pain, and the headache as well. So they also need to get checked for recurrent acute sinusitis or chronic sinusitis.
Another question coming in here, Hans. A question for you, Doc. I used a nasal spray and developed Maronda mumuno. Drama.
quite unfortunate.
Yeah.
Quite unfortunate. But let me just reassure the listener that every drug that we may prescribe to you or that you may get over the counter, there is always a possibility of side effects.
Okay.
So even if you're hypertensive, if you're diabetic, I can prescribe a certain drug to you, and then you can develop side effect. So possibly the listener developed side effect to the nasal spray that they use. So they may also need to visit their doctor so that they can be prescribed something else after identifying which particular ingredient they were allergic to.
Okay, all right, cool. Any other questions for Doc Noxie?
Yes, Noxie. Yeah. Especially if it's complicated and if it's chronic sinusitis. The ENTs, the specialists, they've got some procedure that they do to drain these sinuses, because remember I said if they are blocked, fluid, mucus is going to accumulate, and so they may need to get drained. It can also get complicated because you can also now get infection spreading to the bones of the face, sometimes spreading to the brains if it goes up. It can also spread to the ears, so you may need certain infections, especially if it spreads to the brain, Simba and Noxie, you can get a brain abscess. So you may need to get surgery if it's complicated or if it's chronic sinusitis.
Wow. Okay, Doc, I think for today, that's we're going to wrap it up today.
You're welcome, guys.
And we'll see you again next Thursday, hopefully.
Hopefully.
Definitely. Yes, Doc, have a good one.
Bye.
Brought to you by Cold Seal.
That was the Dr.